Hello, and welcome to the Veteran Benefits Podcast. I'm your host, Rebecca Deming. Today, we are going to talk about a topic that I get a lot of questions on, which is how VA rates mental health disabilities. There's a lot of confusion between PTSD and depression, anxiety, bipolar, schizoaffective disorders. There's a lot of mental health disabilities out there, different ways that your doctor can diagnose it. And so there's a few things that I think it's important for people to understand. The first is that whatever your mental health disability is, it's just like any other mental health or any other disability that VA has. You have to show that you have a current diagnosed condition or diagnosable condition. If you haven't gone to get treatment for it yet, it's important to get that as part of the rating process. VA needs to understand that you have a disability and that disability was caused or aggravated by service, by something that happened in service, or it could be caused by another service-connected disability. Talking about secondary conditions, things that are caused by service-connected disabilities, we have a lot of veterans out there that are suffering from pain. They used to be very active. That you joined the military, of course you were able to run and lift and do all those things. And as the military used up your body, you're not able to be as active anymore. And that can cause a lot of mental health conditions, depression, anxiety, other specified anxiety disorder, depressive disorder, adjustment disorder. There's a lot of disabilities that doctors can diagnose that are caused because of physical things that are going on with your body. If you get a cancer diagnosis, it's pretty rare to get a cancer diagnosis and not have some sort of at least adjustment disorder, some sort of mental health processing of that diagnosis. So a lot of times we'll see mental health things, even though nothing triggered a mental health disability while you're in service, it can be caused by something that happened after service or that started after service if it's connected or caused by a service-connected disability. Otherwise, we're looking for what in service caused your mental health disability. So probably the most common one we see is PTSD, post-traumatic stress disorder. For that, we've talked to guests before, it does not always have to be combat related. If your traumatic event happened in a combat zone or during active duty combat, VA kind of lessens the standard necessary to prove that you had a stressor event. So in order to get service connected for PTSD, you have to prove that you had an event or a stressor that was significant enough to trigger a diagnosis of PTSD. So usually you have to be in close proximity to, or have fear for your life or your safety or the safety or lives of people near you. So if you witnessed people being killed near you, if you witnessed, if your base was bombed and you had a fear that could happen, that something could happen to you, that's enough to trigger PTSD. If you later develop symptoms that a doctor diagnoses as PTSD, VA will usually kind of lower the threshold and show that your current condition is related to service. You can also get PTSD not in combat. It could happen during a training exercise. You could have a physical issue. You could have a bunkmate that something happened to them. It could be a car accident. It could be the common ones we see is military sexual trauma. There are a lot of things that can happen while you're serving the military that can trigger PTSD. If it happens outside of combat, you do have to show some evidence that the stressor occurred. So that could be lay statements. It could be police reports. If you reported something that happened, if you were in a car accident, and you can get those MP reports if it happened on base or civilian reports if it happened off base. It could be statements from friends and family members that witnessed what happened or came to visit you in the hospital or whatever proof you can get that shows that something happened in service. Then VA wants to see if that stressor or that event in service triggered your current PTSD. So you have to have that nexus, that connection between what happened in service and your current diagnosis. If it is a military sexual trauma incident, VA understands that not everyone reports military sexual assault or harassment or abuse when it happens. There's a lot of reasons why people keep it quiet. It's stigmatized. They don't want it to impact their career. So you don't have to have filed a police report. It doesn't have to be in your record for you to be able to prove that it happens. What VA looks for is something called markers. They want to see markers that something happened in service. So if you were Sailor of the Year, for example, and then all of a sudden you start getting reprimanded, you get non-judicial prosecution, non-judicial punishment, you get court-martialed, you start getting reprimanded, you go AWOL, things happen on your record. So you were on one trajectory and then something changes in your record around the time you end up getting out of the military, even though everything prior to that was showing that you were going to have a long career in the military. There are a lot of things that VA will consider as markers. And so what we need to show is that those markers are present in your record, or that we can substantiate that things happened around the time that kind of corroborate that you had a change in behavior or a change in your approach to your career that align with the timing of when you're saying the military sexual event happened, the trauma happened. So a lot of people say, well, I can't file it because I can't prove that this happened or that happened. I always recommend that you put in a claim if you think that it's connected to service, and we can work out the details of how to gather the evidence needed to substantiate that claim and prove that something happened in service that caused your current PTSD. Military sexual trauma, or MST, is not a claim in itself. You don't develop military sexual trauma. It is a type of trauma that can trigger different disabilities. The most common, of course, is PTSD from a military sexual trauma, but it can also trigger anxiety, depression. You could have physical disabilities from a rape or an assault. So VA has a special team or they give special training to individuals that handle the military sexual trauma cases. If it's a mental health condition other than PTSD, typically, and you're not trying to show secondary connection, you're not trying to show that it started after service because of a service-connected disability. Typically, VA wants to see that that condition started during service, that you started experiencing symptoms of that condition during service. It's helpful, of course, if you went and got mental health treatment, but we understand that a lot of veterans don't go seek mental health treatment. So lay statements from you, personal statements about when you started experiencing anxiety or depression, how that impacted you. Those are going to be very helpful. Statements from fellow service members, friends, family members, people who saw a change in your behavior. We've gotten a lot of letters from family members that, when someone returns from a deployment, they left as a happy-go-lucky kind of person with a sense of humor and a lot of friends, and they came back and self-isolated and didn't want to go out, didn't want to leave their room, reduced their circle of friends. Those kinds of things are very helpful to show that you started experiencing symptoms during service and they've continued since service. Of course, it's easiest to show a claim if you went and got mental health treatment and you've been treating ever since service. There's kind of a continuous continuity of those symptoms and treatment. Those are the easiest cases to prove. We understand people don't always get treatment. They don't always continue with treatment. There's a lot of reasons why people don't continue with treatment. Turnover in staff at VA hospitals is one of the main ones. Stigmatization, not having time to go get the treatment. There's a lot of reasons why people don't get treatment. So those lay statements from friends and family who've witnessed your symptoms are super, super important for showing that symptoms started in service and have continued since service. So that's kind of the nutshell of getting a mental health condition service connected. Now, VA rates all mental health conditions under a single code for mental disabilities. So if you have PTSD and depression and you're bipolar and you have anxiety and you have sleep disorder, insomnia or something, those are all going to be rated under the single code. VA can sometimes try to parse it out and say, they'll ask an examiner, can you tell which symptoms are related to the PTSD versus the depression, if one is service connected and the other isn't. But normally they kind of lump them all together. So you're not going to get separate ratings if you have a diagnosis of PTSD with major depressive disorder. You can get one rating that looks at how those symptoms combined impact your ability to function in a social setting and in work settings or school settings. So VA is looking to how your mental disabilities impact your ability to function in life. And that's how they assign a rating. The ratings, you could get a 0% if you really have no symptoms, a 10% rating, 30% rating, 50% rating, 70% rating, and even up to 100% rating for mental health conditions. So I'm going to go through a little bit of the criteria for each of the levels, because I think there's some misunderstanding and some confusion too about how VA rates it and what symptoms to explain. And it's really hard. I hate talking about myself in general. I know when you're dealing with mental health stuff and you've got to prove to VA that it's impacting your life, it can be really hard to think of the symptoms, to explain them well, to document them in a way that VA is going to understand and give you the rating that you deserve. We have a lot of veterans that like to minimize their symptoms. You're used to coping, you're used to making do because that's what you need to do when you were active duty. Now that you're out of the military and you're dealing with this stuff, we don't always have the vocabulary to talk about it, but it's really important to understand what VA is looking for when they're rating things, so that you can talk about your symptoms in a way that is going to help VA understand and give you the appropriate rating. That said, I've seen people try to write their statements and they're kind of copying and pasting the language from the VA schedule of rated disabilities into their lay statement. And they're saying, I've got occupational and social and occupational impairment with deficiencies in most areas. VA knows that nobody talks that way. You're not helping your case by just quoting the schedule that VA uses to rate the disability. VA wants to see examples that fit into the categories of how they rate things. So for a 10% rating, VA is looking for occupational and social impairment due to mild or transient symptoms, which decrease work efficiency and ability to perform occupational tasks only during periods of significant stress, or if symptoms are controlled by continuous medication. If you're taking medication and it's pretty much controlling all of your symptoms and you're fine as long as you take your fluoxetine or your Cymbalta or whatever is prescribed, 10% would be the right rating. If you're taking the medications and it's kind of helping with your symptoms, but you're still having symptoms, which I think is most people that are prescribed medications, the medications help, but they're not going to fully control all symptoms, then you're probably looking at a higher rating. So it's for 10%, it's really if you have some symptoms, they kind of impact your work or social setting, but only under periods of increased stress. The symptoms come and go. They're transient. They're not continuous symptoms. That's the 10% rating. For a 30% rating, VA is looking for evidence that you have occupational and social impairment with occasional decrease in work efficiency and intermittent periods of inability to perform occupational tasks, although generally functioning satisfactorily with routine behavior, self-care, and conversation normal, due to symptoms such as depressed mood, anxiety, suspiciousness, panic attacks, weekly or less often, chronic sleep impairment, mild memory loss, such as forgetting names, directions, or recent events. So again, that's occupational and social impairment. So it's impacting you in work and social settings with just occasional decrease in work efficiency. So only occasionally you're not able to do your tasks. Occasionally you have periods where you call in sick to work, but most of the time you're functioning satisfactorily. And if VA asked your coworkers or your friends and family, they might not notice that anything was wrong with you. That would probably be a 30% rating. So sleep impairment, having nightmares, forgetting the name of the person that you just met, those kind of symptoms would align with a 30% rating. Now, 50% rating is occupational and social impairment. So again, similar words, occupational and social impairment. So it's impacting you in your work setting and your social setting with reduced reliability and productivity due to symptoms such as flattened affect, circumstantial or circumlocutory or stereotyped speech, panic attacks more than once a week, difficulty in understanding complex commands, impairment of short and long-term memory, for example, retention of only highly learned material, forgetting to complete tasks, impaired judgment, impaired abstract thinking, disturbances of motivation and mood, and difficulty in establishing and maintaining effective work and social relationships. So The 50% rating, VA is looking for symptoms of your mental health condition that are really pretty regularly impacting your social and work setting and are making you less reliable in those settings. It's not fully causing you to lose your job or be put on probation, but it is causing you to be less reliable. You might miss certain promotion opportunities. The way you talk about stuff, you kind of have a flattened effect. So when VA lists these symptoms, not everybody's going to have all of the symptoms because depression shows up differently than anxiety, shows up differently than an alcohol or substance abuse disorder. So we're not looking for a checklist of symptoms. These are examples of symptoms that VA would look for that would align with a 50% rating. So panic attacks more than once a week. If you're having panic attacks more than once a week, I know panic attacks can be very disabling. We've had people go into the ER thinking they're having a heart attack, only to find out that it's related to their anxiety or PTSD, and it's actually a panic attack. They can be confusing because you have the physical symptoms that go along with the mental symptoms of the panic. You're really not able to follow complex commands. So at work, if your boss gives you instructions and you're not able to follow through and you need constant reminders, those kinds of things would align with 50% rating. The impaired judgment, we see a lot of people with gambling problems or getting into relationships with the wrong kinds of people. DUIs would probably be an example of impaired judgment. If you're making the decision to drive under the influence, impaired judgment, disturbances in motivation and mood. So people who are feeling down and depressed and are not motivated to get out of bed, not motivated to care for themselves or to leave the house or to engage with work and family and friends. So those kind of symptoms align with the 50%. So we're looking for some pretty significant impact on your work and social environment to meet the 50% rating. The next level rating is a 70%. So for 70%, VA is looking for occupational and social impairment with deficiencies in most areas, such as work, school, family relationships, judgment, thinking, or mood. So they're looking for, do your symptoms impact you in kind of all of these facets of life or in most of these facets of life? Work, school, family relationships, judgment, thinking, or mood, due to symptoms such as suicidal ideation. So if you have thoughts of suicide, even if you're not planning or actively planning to take your life or you haven't thought through a plan, but if you have those kind of dark thoughts, that is almost automatically a 70% rating. There's some case law because the symptom of suicidal ideation only appears in the 70% rating or higher, that if you do have suicidal thoughts, suicidal ideation, that VA can't rate you below a 70%. It can be a very sensitive topic. I know a lot of people are afraid to bring it up if they are having those symptoms because they're afraid of being institutionalized or being stigmatized. But if you do have those thoughts, it can be really helpful to your claim to get you the correct rating if you're able to talk about them. Obsessional rituals, which interfere with routine activities. So a lot of people with PTSD end up with hypervigilance where they're constantly 3 times checking their lock on their door, or they need to sit facing out at a restaurant because they don't want people to come up from behind them. And so you can have those obsessional rituals, but when they interfere with routine activities. So if you're not able to go to the grocery store or engage with your family appropriately, or if it's interfering with your ability to work, that's when it becomes an issue. Okay, speech is intermittently illogical, obscure, or irrelevant. So sometimes people with the 70% level will kind of go off on rants or tangents and need to be pulled back in line to kind of be pulled back on topic. That would be a symptom that would align with the 70% rating. Near continuous panic or depression affecting the ability to function independently, appropriately, and effectively. So this one's interesting because in the 50% rating criteria, VA talks about the symptom of panic attacks weekly or more often. In the 70%, they're talking about near continuous panic or depression affecting the ability to function independently. So people who are constantly on high alert and can never come down from high alert, that even if it's not a continuous panic attack, but if you're kind of constantly at that panic level or constantly feeling depressed, um, you're going to align more closely with the 70% rating if it's impacting your ability to function appropriately and effectively. So again, people who are high functioning with these symptoms, just because you're constantly feeling anxious doesn't necessarily mean that you're going to meet the criteria for a 70% rating. But if your high level of alertness, panic, depression is impacting your ability to function, that's going to align with the 70% rating. Okay, impaired impulse control, such as unprovoked irritability with periods of violence. This one can be hard to talk about, but a lot of our people with PTSD have a short fuse. They have triggers, certain things that really get under their skin, and they're unable to control their reactions to it. And they have outbursts with family. Getting statements from family members when someone's experiencing those symptoms can be really helpful to illustrate to VA what's going on. Impaired impulse control can also manifest as substance abuse disorders. If you're making poor decisions with the amount of alcohol you're using, the amount of drugs you're using, with sexual partners, with driving under the influence, or, we've had clients tell us that they drive and close their eyes on the highway. Things where you're impulsive. We've had clients that have gambling problems where as soon as they get their VA payment, they're spending it all on the casino and the slot machines or online gambling or whatever. So impaired impulse control is one of the symptoms. Spatial disorientation, forgetting where you are, getting lost in familiar areas, neglect of personal appearance or hygiene. And this one, when I'm talking to clients, I'm usually asking them, if they go days without showering, if their spouse has to remind them to brush their teeth, if they often wear dirty clothes and someone has to say, hey, you might want to put on a clean shirt because we're going to dinner. Those kinds of things are symptoms that we see not all the time, but they are the types of things that we sometimes see in people who meet the 70% criteria. Difficulty in adapting to stressful circumstances, including work or work-like setting, and inability to establish and maintain effective relationships. So a lot of people will kind of self-isolate. They'll form a few relationships, family or friends, and they are unable to form additional relationships because of their mental health disabilities. So you don't have to check the box. It's not how many of these symptoms do you have, but if you can describe your symptoms in ways that align with the way that VA rates in the types of things they're looking for, it can help VA understand that you meet the criteria for this level of a rating. The next level is total occupational and social impairments. That's the 100% level. So it's total occupational and social impairment due to symptoms such as gross impairment in thought process or communication. Say that again, gross impairment. So major impairment in thought process or communication, persistent delusions or hallucinations. So dissociative episodes, thinking you're hearing voices, those kinds of things, grossly inappropriate behavior, and then persistent danger of hurting self or others. This is a big one. So remember we talked about the suicidal ideation meets the 70% criteria. People who are persistently at risk of following through on a suicide attempt would meet the 100% criteria, even if they aren't otherwise delusional or having other impairments, if they are constantly at risk of hurting themselves or others. So this can also be substance abuse disorders that kind of go to the extreme. If the doctors determine that you're at a risk of hurting yourself or hurting others, so violent outbursts could qualify for the 100% level. Intermittent inability to perform activities of daily living, including maintenance of minimal personal hygiene, disorientation to time and place, memory loss for names of close relatives, own occupation, or own name. So when you read that, I think a lot of times people think, oh, you have to be kind of in a white jacket in a padded room to qualify for the 100% level. And if you are, if you are someone listening to this who knows a veteran who is kind of completely out of touch with reality, maybe living on the streets, doesn't know their own name half the time, that person would certainly qualify for the 100% disability level. But the big one here that we see most often are the people that, because of their mental health disabilities, are at risk of hurting themselves or others. So that's how VA rates stuff from 0% to 100% on the mental health scale. And if you have multiple disabilities, VA is going to rate them, multiple mental health disabilities, VA is going to rate them under a single rating code. Now, like any VA disability, there are things that VA will not rate as a disability. So if you came into service with a mental disability, VA might say it's a pre-existing condition. In order to show that it's a pre-existing condition, they really have to show that by clear and unmistakable evidence that you had basically a diagnosed condition prior to joining service and that the service knew about it and gave you a waiver. Or of course, if you lied about it on your entrance exam, then that would be a disqualifier as well. They have to show that something really clearly and unmistakably predated service. So just because you had a traumatic childhood doesn't mean that VA can say, oh, well, all of your trauma now is related to what happened in your childhood, and we're just going to forget about what happened during service. VA takes you as you are once the service accepts you in. So if someone comes in and they're a little bit more fragile because of their upbringing, because they came from a broken home or a dangerous part of town, and then once you're in, you're exposed to additional traumas or stressors or dangers, and that's what kind of tips you over the edge and causes your mental health condition, then VA is going to give you that rating. They should. We're going to argue that they need to give you that rating. Your mental health condition began during service or was caused by service. So just because you had prior trauma before joining service is not a disqualifier. We get that question a fair amount. VA will not rate what they consider personality disorders. So a personality disorder is not considered a mental health disability. It's kind of technical, but it's really more a way of behaving, a way of acting. Ted Bundy is a classic example of someone with personality disorders, narcissistic personality disorder, antisocial personality disorder, which I believe is what they now call, what we used to call psychopaths and sociopaths. Those kinds of personality disorders are not considered disabilities that VA will give a rating for. That said, a lot of times medical providers will misdiagnose people who have mental health disabilities, especially PTSD, with a personality disorder when it's a misdiagnosis. And so if you have a personality disorder on your record, you might want to get another medical opinion about what's going on with you, or if there's more of an explanation. We also do see, at least historically, I'm hoping that the trends are changing, that people of color are more commonly misdiagnosed with personality disorders when they really have diagnosable conditions like depression, anxiety, or PTSD. So just because a personality disorder is written on your record, don't stop there. I mean, if you've gotten multiple evaluations and they've pretty clearly said that that's what you have, then you want to work with your therapists and work through your behavioral and personality issues. You're not going to get VA disability payments for them, but just because somebody diagnoses you with that, I would definitely want to take a closer look and see if there's something underlying that, especially if in your heart of hearts, you kind of know what caused your behavior patterns. We see people all the time who are like, I was doing fine. And then, my roommate committed suicide, and that's what kind of threw me over the edge. And ever since then, I haven't been able to sleep well at night, or the stressors of being on a ship in an area close to conflict is what caused me to stop sleeping well at night, or caused me to start drinking to be able to fall asleep. And because I drink to fall asleep, then I'm tired during the day, so I take uppers during the day. And so now you've got a substance and alcohol abuse disorder to manage those symptoms that started while you were on the ship. We do want to look closely at what the diagnosis is, but VA doesn't rate, there's not one diagnosis that's better than another diagnosis in terms of getting VA disability payments. So VA is not going to automatically give a higher rating to PTSD versus someone who has generalized anxiety disorder. You could have generalized anxiety disorder and have symptoms that meet the 70 or 100% criteria. And you could have mild PTSD symptoms that are managed with medication and you get the 10% rating. So the diagnosis is not what drives how much VA rates you. It's the symptoms and the way that those symptoms impact your ability to function in social and work-like settings. So I hope that that answers a lot of questions. If you found this information helpful, please like and subscribe and post comments and questions in the comments section underneath the episode. Look forward to talking to you next time.